Hi, I'm Janet. I'm a chemotherapy nurse and a chemotherapy patient. And this is
I'm Jen. I'm the chemo pharmacist at the Burnaby Clinic, and we're gonna just have a nice chat today with Janet.
and Freya. Freya is the treatment the treatment dog or the therapy dog, and she's going to help us tell you about things that you need to know when you're going to have your first chemo treatment. Yes, yes. The first thing that Freya wants everybody to know, and she's written it down very clearly, and that is you can bring a snack. She's waiting for her charcuterie board that she ordered.
Sometimes some of the pre-medications we give you to prevent nausea and vomiting, it's best to actually take them with food. So I advise to just eat a little bit before you come in. Don't come in for treatment on an empty stomach.
See what else? We have free Wi-Fi, we have warm blankets, we have pillows, we have lounge chairs. You can bring your laptop and watch a movie. If you're bringing a laptop and you're going to watch a movie, make sure that you have headphones or earphones because we don't want to disturb the other people.
Okay, so the second tip we have for everyone is to bring a friend or a family member with you for your first treatment, and there's a couple of reasons. So first of all, we never know if you're going to be allergic to the chemo treatments that we give you, so it's good to have a family member here in case you actually also need a ride home after. So therefore, we also don't advise you drive yourself to your first treatment. Sometimes we do have to give you medications that can cause drowsiness as well. The other thing too is it's always good to have a support person, and for your first treatment, we usually do allow one person to be in the treatment room with you. And also the nurses sometimes will give you some more information on your first treatment, so it's good to have a second set of ears. You don't need to usually worry about writing things down, as you should have gotten this blue folder with all the written information, either at the education session or on the first day of your treatment from the nurses.
Next, we're going to tell you exactly what will happen when you come to the clinic for the first time. First, you'll check in with the ladies at the front, make sure you have some ID with you, and then you'll sit in the waiting room. And the nurses will call you when they're ready for you.
Freya Funk, could you please come in? Now we need to put this on your arm just to make sure we know who you are. What's your name? Freya Funk. You have to tell me your birth date. Yes, what month? And the year? Okay, so then the nurse will take your vital signs, and then she will go and prepare the medications that the doctor has ordered for you. If you don't have a power port or a portacath, it's sometimes called, you'll know if you have one or not. So the nurse will either access your portacath, or she'll just start an IV. Our nurses are really, really good at starting IV. They're absolutely experts. They've done it forever, so don't worry about that. Some of the things that you can do to make it a little bit easier for them to start your IV is to drink some water in the morning so that you're not like really dehydrated, because it really makes a difference that your veins will pop out. Also, the nurse will wrap a warm blanket around your arm to try and make that blood come up and make the vessels look, you can see the vessels more.
Okay, so now that your nurse has started your IV, the first thing they'll do is just run some normal saline in, so it's not your actual treatment starting yet. At this time, if there are pre-medications in your treatment protocol, the nurse will be giving it to you. So,
Thank you,
for example, sometimes we give IV Benadryl or other IV medications to help prevent allergic reactions. You may also be given anti-nausea pills like ondansetron or dexamethasone, which is a star-shaped pill. Sometimes can give you a little burst of energy and make people have trouble sleeping at night, but it's a very short-term effect. So after all the pre-medications are given, then the nurse will hang the bag of medication if it's IV drip. Also sometimes the treatment medication can be an injection directly into your tummy. You'll always know if they're giving you a treatment drug because they always have to ask for your name and birthday. And even though we all know who you are, every single time, name and birthday. The other thing too is sometimes you might see the pharmacist come into the treatment room. So before your first treatment, hopefully the pharmacist already got a complete list of your medications, vitamins, herbal products, and supplements to check for drug interactions. But in the case that the pharmacist didn't get to speak to you before your first treatment, they'll probably come speak to you in the treatment room. So make sure you have your list of medications, vitamins, supplements, and herbal products ready if you haven't spoken with a pharmacist before your first treatment.
Okay, so with the IV, you're not our captive. You can actually unplug it so that you can go to the washroom. It rolls around with you. We need you to stay in the treatment room though, so that we can keep an eye on you. When your chemotherapy is finished, the nurse will either flush your port or take your IV out. At that point, you can usually go home. Sometimes you have to stay a little bit of time to make sure that there's no interactions, right?
Yeah, so sometimes there are certain medications where it looks like you're all done, everything is in, and then we tell you, oh, you need to stay for 30 minutes or you need to stay for an hour for observation. And it's just to make sure that you don't have a reaction or allergic reaction to the medication that we gave you. So each drug is very specific whether or not we need to do that. So you may see other people that get all their drugs in and they can just leave right away. They're probably not on the same medication as you if you've been told you need to stay for an observation period.
The chemotherapy infusion should not be painful. If you're feeling pain anywhere around your IV site or in your port, you need to let us know right away. Don't say, well, I didn't think it was that bad. You really do need to know right away because we don't want to injure any of the tissues that are around your IV site with the chemotherapy. That can be really a dangerous thing.
So definitely no burning, but sometimes you might find like it's like a cold sensation because you have to remember that drugs are at room temperature and your body temperature obviously is much higher. So if it feels a little bit cool, it's okay. But if it's burning or painful, then it's like a definite not okay.
Sometimes you'll see it'll go right up your arm and it'll be a little bit painful. Just let us know because there's lots of things that we can do to make it comfortable. The problem is if it's doing it for too long, then that's when it starts getting dangerous. So let us know right away. You're not bothering us.
Okay.
There will be a nurse in the room when you're getting your chemotherapy the whole time. So they'll be able to assess how you're doing, if you need anything. Please, please make sure that if you're feeling unwell or you're feeling nauseated or anything like that, just let the nurse know. She knows how. Everybody in the treatment room, in fact, all of us are really highly trained to be able to manage any complications that might occur.
Handling cancer drugs and body fluids when you get home after treatment. So in the blue folder that I had shown you earlier, in the earlier tips, there will be a handout in there, and it is titled Handling Cancer Drugs and Body Fluids in the Home. In terms of sort of body fluids, and a lot of people sometimes ask like about hugging or kissing or sex, because those are very important things.
Yes.
Obviously, if you hug someone, it's fine. You don't give them chemo that way. You can even kiss someone after treatment. That is also safe. In the handout, it does specify avoiding deep kissing. And usually we would say for the first 48 hours after treatment. So no deep kissing, unfortunately. But if you want to have sex, if you're feeling up for it, because why not? Just make sure you're using protection such as condom. The dietitian will normally come see you on your very first treatment, so they do have access to a list that tells them who's in here for the first time. So make sure you bring any questions you have regarding diet, maybe supplements, what you can eat, what you can't eat.
We use a multidisciplinary approach here, so we have lots of other people in the background that you can access, and one of our most important multidisciplinary team members is the social worker, Easter, and she's just wonderful. There is support and someone around to talk to you. So you can see Easter, make an appointment with her. You know, there's a lot of pain and well, there's not a lot of pain. There's a lot of
Anxiety.
Anxiety, yes. There's a lot of anxiety and fear around getting a diagnosis of cancer, and those feelings should not be ignored. And Easter is here to help you work through those feelings.
The pharmacist is available too.
Yes, that's another
for medication-related concerns.
Yeah.
We are located right next to the treatment room, so you can also feel free to just pop by our office.
Finally, the last thing that you should know is before you leave, have a plan for next time. So the nurse or the unit clerk will give you a slip of paper, and it'll tell you when. I think it tells you when you have your blood work, right?
Yeah, it should probably tell you to do your blood work 2 hours before the doctor's appointment. So that way, when you come see your doctor or oncologist, the blood work results will be available, and the oncologist can then review it with you at your appointment.
Do they do it all? Do some people do it like the day before or something like that?
Yeah, some people might do it the day before, but say, I mean, if you live far away and you'd rather just do it all in one trip and just, you know, come a bit earlier, then we can do like same day as the doctors.
Perfect, yeah, because the doctor will see you before you get your chemotherapy treatment. And then it'll give you a time and a date for your next chemotherapy treatment. So make sure you have that piece of paper in your hand before you leave so that you'll have all that information handy.
Yeah.
Thank you so much for listening, and we will see you around the clinic. Or you'll see Jen, not me. You'll see me as a volunteer and Freya as a volunteer.
But I'll be around in the clinic, and hopefully you enjoyed our tips today, or I guess what to expect for your first treatment.